Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here with a brief overview of the medication Digoxin. As with all my videos, this is for informational purposes only and not intended as a substitute for a healthcare provider. So first off, what is Digoxin? It's an antiarrhythmic agent, also a cardiac glycoside used to treat heart problems, is what some people simply call it my heart pill. In the U.S., brand names Digitech, Digoxin, or Digox, and Lanoxin are available. Used to treat specifically atrial fibrillation or atrial flutter. Also used in certain heart failure patients with reduced ejection fraction. Now, digoxin, it has fallen out of favor. It's typically not going to be first choice for most patients. The tablets in an outpatient setting or outpatient pharmacy are available in 125 micrograms or 250 micrograms, typically dosed once a day. Doses are going to be lower if your kidneys are not functioning well. If you're older, the elderly, the doses need to be adjusted, and if you have a low body weight, the dose also needs to be adjusted for that. Digoxin side effects can include headache, weakness, dizziness, mental status change, so things like depression, um, things like anxiety, hallucinations, those can be associated with digoxin sometimes. Changes in vision. Others can include nausea, vomiting, diarrhea, and loss of appetite, and there are other more rare side effects. Digoxin toxicity is something we need to be mindful of if we're using this medication. Symptoms that may indicate the levels are too high in the body include loss of appetite, nausea, vomiting, changes in vision, visual changes, abnormal heart rhythms. Some of the factors that increase the risk that you could have toxic levels of digoxin in the body include low body weight, increase in age, poor kidney function, or electrolyte imbalance. So things like calcium, potassium, magnesium, if those levels are off in the body, that could increase the risk of becoming toxic with digoxin. Some drug interactions, there are many drug interaction potentials. Just because there's an interaction doesn't mean the medicines can't be used together, but all your healthcare providers need to be aware of all the medicines you're taking so they can screen for interactions and monitor labs accordingly. Blood pressure medications, obviously, if you're on digoxin, most likely you're going to be on a blood pressure medication too, but especially a new start or dose change, we have to be cautious as that could change the levels of digoxin in the body. Diuretics or water pills can affect the digoxin levels. Again, we have to be cautious on new starts or dose changes. NSAIDs. NSAIDs are things like ibuprofen, Aleve, naproxen, Advil. Oftentimes, NSAIDs are not recommended in people with heart conditions anyway. So most likely, if you're on digoxin, there's a pretty good chance your healthcare provider would not want you to be using NSAIDs. But if you do, that could affect the levels. Over-the-counter product like St. John's wort can also have an effect on the digoxin levels. So be certain if you want to use some of those over-the-counter medications that your healthcare provider is aware of those and can monitor for side effects. And there are many others again, so that's why we want our pharmacy, all of our doctors to know the medicines we're on so we can screen for some of those interactions. Thanks for watching. Please like and subscribe.